The development of the West Australian Mental Health Research Strategy really started because the Department of Health and the Fury Fund wanted to understand what research questions really were priorities for the West Australian community. We needed to know what research questions, if answered, would have the biggest impact on the community. And the only way we could know that was to consult widely with the community, to consult with our lived experience experts and with our mental health researchers in Western Australia, policymakers and healthcare workers. So we undertook some preliminary work to understand these factors that would have the biggest impact through a large-scale consultation, through a Delphi study, and that involved two expert panels. One was a lived experience expert panel, and the second was a mental health professional expert panel. What we'd love to achieve through the strategy is collaboration across the sector. So we want to bring together the research institutes, the health service providers, our consumer and community involvement partners to work together to really do innovative, high-quality research that is world-class. Our plan is for the strategy to attract more funding to Western Australia, to build the profile of our mental health research in Western Australia, and most importantly, have the biggest impact as possible on the community of Western Australia.
I think it's really important for WA to have developed its first dedicated mental health research strategy because so many members of the WA community experience mental health challenges, especially with the experience of COVID over the last number of years. Many people are experiencing mental health challenges for the first time, and it's really important that people with lived experience benefit from the research that's being conducted. So people with lived experience worked with other research stakeholders to co-design the mental health research priorities for WA, but also the reality is that there's finite research funding, and mental health is so important. It affects a large proportion of the community, so to have a dedicated strategy is really important because it gives other people the opportunity to benefit from the research, but also have the opportunity to recover like me.
I think it's really great that the research strategy is capturing the voices of consumers and lived experience, because ultimately they are the end users, and so they know what they need, they know what the gaps are, they've encountered the mental health system for many, many years, and they know the strengths and weaknesses, so they know what needs to change and how to change it. I'd really like to see research translated into usable services that are effective in terms of health outcomes and also in terms of cost. I think that by working with lived experience, you will get the best quality for money because you're spending it on things that are actually needed and will be used.
So the process that's been involved in not only the development of the research priorities, but also in the development of the strategy itself, has set a new standard for WA and also given notice nationally to the development of research strategies at a national level. The involvement of people with lived experience has brought a degree of expertise in balance with researchers, clinicians, health practitioners and colleagues as well. So we actually have a remarkable picture that has informed what we should be doing in WA in terms of mental health research for the next 5 years. It's a tremendous project. I have been thrilled and so proud to be involved in it as it's gone along, and I cannot wait to see what happens next.